Hello, welcome to In Focus. I'm Tracy Lair. A local doctor is back from Iraq. Dr. Christopher Ryan of Sansum Medical Clinic spent 4 months working in northern Iraq as a military reservist and a major. The doctor served as a liaison. It's now my pleasure to welcome Dr. Ryan home and to In Focus. I was going to kid you and call you Private Ryan, but you're a major.
That's correct.
So
Thanks.
that's pretty amazing. As a reservist, so many reservists are up 2, 3 tours, but this is your first one to Iraq. Is that correct?
That's correct, Tracy.
So I went over to for a deployment, a typical what's called an AEF, Air Expeditionary Force deployment. The way the Air Force works is they deploy forces for 120 days. And so I went in a normal cycle to support a mission that was already well established and active, and that's a major trauma center that's right in the middle of Iraq, and it's about a 100-bed hospital, has about a 20-bed ICU and 4 operating room suites, and it was the main hub for trauma. So I went over there. I actually joined the reserves wanting to deploy. I'm with a unit at March Air Reserve Base that's called an aeromedical staging facility. So it's designed to help move patients from a war zone to a safer area and kind of to the next stage of care. Was also a flight surgeon, so the flight surgeon's role is to clear the patients and make sure they're safe to fly, and then one of our other roles is to be in charge of any kind of flight line emergencies, aircraft accidents or crashes. If there's aircraft coming in that have had an incident like the F-16s, if they got depressurized and the pilot had the chance of having the bends or some other kind of altitude injury, then we would take care of them. In my previous Air Force job was a search and rescue flight surgeon, so I had experience with helicopters, so I got tasked to be the liaison with the Army's medevac companies, which are the air ambulance companies that go out to whatever the situation is, and they pick up patients and stabilize them and then get them back to the trauma center. So I got to interact with the medics that flew on these helicopters and fly with them and help to train them so they could do their job better. And then also was used as a medical physician to care for critically injured patients that were being transported throughout the country. So sometimes I would go to outlying bases and then come back or bring patients back to the trauma center that were not stable enough to be transported without a doc present. Before I even joined the reserves, Carrie and I, my wife, prayed about it and felt like, this was something that I was supposed to be doing. So, I think, and even the kids, were willing to let me do that. And I felt so privileged that they were even willing to let me do this thing. I mean, some dads goof off and play golf or, I don't know, buy a sports car, when they turn close to 40 or whatever. So, my midlife crisis was joining the reserves and going to Iraq.
Anything you'd like to add before we say goodbye? And you have to keep us posted with if you're heading back again.
Just thankful to my family for their support, thankful to my faith in the Lord that sustained me through my whole time over there, and thankful to the clinic that I work for, their support.
Well, you're a lifesaver. Thank you so much, Major Dr. Ryan.